All right. Hi, guys. Sorry for the technical difficulties. Hopefully, we got that fixed now. But hi, everyone. Welcome back to another Dental Shadowers virtual shadowing session. Thank you for joining us today. My name is Dia, and I'm part of the Dental Shadowers e-board, and I will be facilitating today's session with Dr. Graves, an oral and maxillofacial surgeon. And thank you so much for joining us, Dr. Graves. The floor is yours whenever you're ready.
All right, and we're live, right? This is working, right?
Yes.
I just figured this out.
Finally.
Man, you guys have enough Florida. The people up in Michigan, they had no problems when we did theirs. I'm not
Oh
saying
man.
don't call anybody out, okay? Saying no.
Sorry
So
about that.
I'm. No, you're fine. At least you got the maxillofacial right.
Yes.
That's important for your dental school interview. Remember that. But so I'm a oral surgeon. I'm in West Texas. We have multiple offices. I have offices in Oklahoma. We're kind of near New Mexico. We have multiple dentists and specialists that work in our practice. We have pediatric dentists, we have general dentists, and we have um, oral surgeons, of course. We've had plastic surgeons in the past, and we've had orthopedic surgeons in the past. And our office is kind of set up sort of like a residency program, if you will, because of the multiple specialties. We can kind of bounce different treatment plans off each other. So it's kind of the way I envisioned the practice when I first started it 12 years ago, and it's kind of developed to that. So it's maybe like a special situation as compared to what most private practices would look like. We do a variety of surgeries from typical dental surgery to we did a rhinoplasty last Saturday in our office, but we do a lot of facial reconstruction cases and implants and wisdom teeth. So, I mean, we're a broad spectrum practice. And I guess kind of where the start is I know a lot of you guys are going to dental school or applying to dental school is, okay, kind of what's the difference between what a dentist is and what an oral surgeon is, and, going through school, what's the education variance between the two. So I have a slide here. Maybe I can pull this up. All right, can you guys see that slide on your screen? I'm assuming you guys can hear me talk, right?
Yeah, we can see
All
that.
right, so I mean, you guys are going to dental school, so I'm assuming that you guys know a little bit about applying to dental school, and I can answer questions about applying to dental school. And but people love to ask me questions about the DAT and what I did in my interview. And I mean, that was 16 years ago for me now. So I'm sure those things changed a lot over the time. And I don't remember a lot of the dental school interview stuff. Only thing I remember for sure, you just have to say maxillofacial, right? This is one of the important things.
Main thing,
You may not get in if you don't mess that one up. But so dentist. So you go to college, you get your bachelor's degree, you go to dental school, and all dental schools, for the most part, with the exception of maybe Pacific University, are going to be 4-year programs. And this slide is we do this education program every February that we do to high school students. So this was kind of geared towards them. So it's a little simplified, probably than what you guys need. But when you're a dentist, I mean, you do dental stuff, right? You do crown and bridge, you do fillings and restorations, you have periodontal stuff that you do. So kind of what is the difference between what a dentist does on a day-to-day basis versus what I'm doing on a day-to-day basis? And to be an oral surgeon, you have to go to dental school for 3 or 4 years, depending on where you go. Residencies range anywhere from 4 to 6 years. Some residencies you get your medical degree, and some that you don't. And at the end of the day, everybody essentially does the same thing when they're finished. The surgeons at our office that do the rhinoplasties, they don't have their medical degree. So just getting your medical degree doesn't allow you to do more procedures. So, I mean, there's always argument, you get your medical degree or you don't. And I always will say that having a medical degree and 2 years of education extra isn't a bad thing necessarily, But, on a day-to-day basis, like today, for instance, I take out a couple sets of wisdom teeth and I did a couple implants today. And that's kind of a routine day in my office. We also do things like these full arch replacements where we remove all the teeth and we place dental implants and we make teeth the same day. So it's you go from having bad teeth or no teeth to having like teeth that are screwed into your upper and lower jaw. And
Mm-hmm.
I call that the 4-hour smile. The more popular name is the all on 4. But we do a lot of those cases in our office. We do tons of bone grafting. We do facial trauma. So I always tell people, oral surgeons are kind of we're kind of a weird group of a specialty. And I say that's because we are dental specialists, but we're also kind of in the medical field. So we work in the hospital a lot, and we do facial trauma, and we share this facial trauma with ear, nose, and throat doctors and plastic surgeons. So a lot of different facilities, they'll have an oral surgeon on call for facial trauma 1 week, and then the next week, doing the exact same cases and the exact same type of trauma, it will be a plastic surgeon. And then the week after that, it'll be an ear, nose, and throat doctor, and we kind of share that rotation. So we're doing a lot of the things that people would traditionally associate with being some type of a general surgeon or a plastic surgeon. And a lot of people don't think of a dentist as doing an orbital fracture or fixing a nasal fracture or doing a cheekbone fracture. But I mean, we fall in that realm, and those are things that we do.
Mm-hmm.
And the thing that I enjoy doing is I like doing the jaw surgeries and I like doing the pathology. And I'll show you guys a pathology case that we recently did not too long ago.
The chat's also saying, can you make it full screen when you do?
Oh, you mean on my thing?
Because it said it was blurry. So
Okay.
I don't know if
We have a very high maintenance following on our TikTok right now.
No, that's on YouTube.
Oh, that's on YouTube.
Yeah, it's on YouTube. Yeah.
Oh,
The
never
live
mind.
stream probably.
They are high maintenance. Yeah.
We have a very high following on. You guys have a very high maintenance following on YouTube. I take that back.
Yay.
Not people are fine. They're probably intoxicated right now. All right, so let's go through like a pathology case. So this is a case I'm going to show you. This guy came in. He had this big tumor on his face. Ended up being a charity case. We ended up doing the case for free. And at the time, we were filming a TV show, and one of the people we were filming for at the time was TLC, and their crew had already left and finished the filming that we had done with them, and we'd filmed with them for about 2 or 3 weeks. And then this guy comes in, so I send them pictures of it. So then they all get back on an airplane and fly right back from LA because they want to film this guy.
Mm-hmm.
And this show never got, well, it hasn't got picked up yet, and we'll see if it gets picked up or not.
If any of you guys want to pick it up.
If you guys have connections, you know what I mean? You're more than welcome to do that. But, so this is Charles right here. Now, what do I need to do? Make this larger? Like, is that what they mean? Like that?
Yeah,
let me
but
check.
for full screen.
It's full screen, right?
So you can see it. Let's see.
All right, you guys. All right, so we'll just go through this case. So this is Charles. So Charles just walks into the office one day, and he has this big, huge tumor growing on his face. And this tumor's been there for maybe 2 years at the time. So, I mean, when you have a tumor this large and it's growing that fast, I mean, it's probably not a good thing. I mean, it's not a good thing to have something on your face like this, but I mean, 2 years is pretty rapid growth to get something this large on your face, right? So he comes in, immediately take as many pictures as I can of this thing. We get a CT scan of it, and you can see how large this thing is. So, on a CT scan, whenever something appears black, then that means it's real radiolucent. So it's not real dense. So the radiation beam's going through it. So whatever's in there is probably filled with a lot of liquid maybe. It's definitely not bone that's growing in the area. So we start thinking to ourselves, okay, I start thinking to myself, this is probably a big thing of fat that's been growing in this cheek. And just based on that, it's either going to be probably a couple things, but high on the list would be something called a lipoma, which is a benign fatty tumor. And then the second thing would be something called a liposarcoma, which is a fatty tumor, but instead of being benign, it's going to be a malignant form of that. Only way, I mean, it's probably going to be a liposarcoma because lipomas would take like 300 years to get this big. So we're thinking it's a liposarcoma, but the only way of really knowing is to kind of go in there and just take the thing out and let's figure out what it is. So there he is getting ready for surgery right there. I have a little video that I like to play about Charles here. Let me do that real quick. Right. So this is a little, and so this is part of the footage that they filmed when they came in to film the surgery.
Mm-hmm.
So it's a little bit raw footage. You guys can see that, right? On YouTube, right? Let me see.
I don't think so.
Sorry.
Yeah, there you go.
Okay.
Okay.
Is it on there, Chris?
It takes a while.
Okay.
It looks good now, Dr. Graves.
All right. You see the TV screen here?
Yes.
Okay.
Yeah.
And I can't get back to sleep. And then just messing with this thing and this and scratch, and it don't hurt. And then I never feel it, it's never give me no trouble.
Charles Hall is my ex-husband, but we are close friends still.
She takes me places and do things, and if I need some help, she helps me. She doesn't that, they just say the same old thing. This mom will be mad again.
I have to get most of his shirts, and I have to cut them, like right here. And have to cut it so that way it'll fit over his head and with that big ball.
As you scroll through, you can notice, this tumor is about the size of the rest of his head. So if you were to measure this area right here, that's about the size of the rest of his face. Just this extra growth of tumor he has right here. So this is all grown this size in 1 year? Does it hurt?
No, it just don't hurt.
You got any numbness anywhere?
No.
Can you feel me touching right here?
Like that.
The thing that concerns me is as you kind of scroll down on the CT scan, this thing really goes pretty deep into its neck right here. Typically lipomas don't get this big. And if they do grow this big, this rapidly, they're typically a liposarcoma, which is the cancer version of what a lipoma is. Charles, do you have any questions about anything for me?
No, I don't think so. I'm ready to eat.
You ready to eat?
Yeah.
Yeah, I bet you are.
I am, but I'm hungry. I'm looking forward for surgery tomorrow, and I'm just looking forward to a good day.
Got the biggest lipoma in the history of the world right here on the head and neck. By far, the biggest one. Jeez. All right, here's our final weigh-in on our lipoma. Looks like we're at 3.6 pounds on this lipoma, which could be the world record for a facial lipoma.
Wow.
We got some before and afters. We don't have it on the video, but I have some before and after pictures of that thing right there. But it was huge. I mean,
Yeah,
it's pretty
that
cool.
looked amazing.
obviously you don't get cases like that walk in every single day of the week. You know what I mean? So I mean, we end up doing it for free. And the reason that Charles didn't have that done sooner was he just couldn't afford to have it done. And I guess people have the impression that there's a will, there's a way. So he walked around with this thing for 2 years, and heck, I mean, I told him, I was like, man, if you would have came here 2 years ago, I would have taken this thing out for free. I mean, and so that was part of the thing. And actually, the day of the surgery, I mean, I probably would have paid Charles to do that surgery. I'm not going to tell him that, though. I mean, you don't see that every single day, and it's a cool case. And I mean, those are cases that you enjoy doing, and I have a lot of fun doing those cases. Definitely something unusual that you don't do every single day. But actually, that we did this on a Saturday, just because I did it for free, and it's hard to do all these pro bono cases, and we still have to pay the bills of the office. So since I did it on a Saturday, I had that tumor in the front seat of my car. So I drove around for 2 days with that big tumor in my car so I could take it to the hospital and send it to the pathologist because they were closed on Saturday. So I drove around for 2 days with that thing in the front seat of my car.
Oh my God.
Let me see here. So here's just a couple like still shots of the tumor when we were taking it out. I guess these people want me to do this, right, Chris?
Yeah.
Okay. So, you notice I use my hands a lot when I do the dissection on there. And the reason I do that, just, when you're deep, first of all, these things have a big capsule on them. And when you're into the neck, you can find a pretty good plane that you can kind of separate the tumor from the underlying tissue. And when you're deep in the neck, you just don't want to put a lot of sharp instruments down in there because there's a lot of real estate in the neck that you don't want to accidentally damage. There's a lot of big vessels in there that can cause a big mess if you damage them. So I like to use my fingers, my hands a lot when I can do this. Luckily, God gave me these little dainty fingers, these dainty hands that I have. So it allows me to really get in there. You know what I mean? I was like made to be an oral surgeon. These little bitty hands. But here's a couple more pictures of this thing. I mean, it was pretty impressive. I mean, it kind of grew its own vascular system. You see that big vein right there that kind of grew, that supplied this tumor with the blood supply to it. The thing that was unique about this tumor was, I mean, we thought it was a liposarcoma because of the size, but when we initially sent it to the pathologist, it came back as a lipoma. Which, if it was a lipoma, it would probably be the world's largest lipoma ever. I mean, even as far as liposarcomas come, if you just look at the literature, there's just not that many giant liposarcomas of the head and neck. I mean, people get some of these bigger than this in your abdomen, but to actually have something like this grow in your neck is extremely rare. But it originally came back as a lipoma, which would, like I said, which was no one thought that's what it was. So they actually had to send it off to get special stains done. A lot of times they'll send this to the US military, and they actually did DNA sequencing of it, and it came back a liposarcoma, but it came back a liposarcoma that's not very aggressive. So Charles didn't require any type of chemotherapy or radiation, just a surgical removal of this thing, and the follow-up is all we really need to do with Charles right now. Now, there's a chance this thing may grow back, and if Charles lives to be 350 years old, it probably will grow back. So we have to monitor it, but it wasn't an aggressive type that would require other types of treatment. So here's kind of his before and after. I wish I would have got an after of him not shaven, but I just wasn't he wasn't down for that. So this is the best I got. So this is
awesome.
So this is a pretty cool case. I mean, we don't do these cases very often. I do a lot of pathology cases, though. For some reason, just in our area, we tend to have a lot of pathology cases I end up doing. So we do a lot of like resections and reconstructions with bone grafting that we have to end up doing. I guess some of the other cases that I enjoy doing is, I told you these all-on-4 cases that we do, or this 4-hour smile. And we have a program in our practice that every year we give away one of these surgeries for free. And that's something we've done for about the last 5 years. And the surgery bills out at about $50,000. So we have an application process where people apply for themselves to be the recipient of this, or you can apply for somebody else. And we typically get a couple of thousand applications for this. And then we have to narrow that all the way down to about 20 people. And then on those 20 people, I personally interview the last 20 people, and then we do an exam on the last 20 people and x-rays that they get for free. And then based on all that information, we choose our winner. And we just chose a winner of the one that we're going to give away this year. I did that maybe a week and a half ago. But like I said, it's a program we do. It's called the Smile Again program. And I have a little video that I'll show. And this was the very first one we did, the Smile Again program. But this is something that, I mean, we do lots of community service in our area, and we do a lot of education programs for the community, and we can talk more about that kind of stuff. And I guess some of the rewarding stuff as far as being an oral surgeon is you kind of put yourself in the position that you can do a lot of this stuff. And I would think that's probably my favorite part about, other than doing the surgeries, my favorite part about being an oral surgeon is I kind of position myself that I can do some of these things. But this next video I'm going to show, this is, pull this up. Like I said, this was our very first one that we had done. And at the time, we hadn't planned on doing a video. I just had a friend that was in town that he works in LA, and he's in the film industry, and he kind of just filmed some stuff as we were doing. He was just visiting, and he put together a video of like Ruby's story. And this is a long time ago. I have a much different haircut in this one than I did the last one. The last video, I'm like the Joel Osteen, just like the picture you guys have of me on the thing. It's like the Joel Osteen look, you know, and I look like an evangelist, which I hate. And this one, like I said, this was a couple of years ago. So I do a lot of talking with my hands, even though I don't know sign language. You wouldn't believe I didn't. A lot of talking with my hands on this video. And let me see, this is Ruby right here. No, this isn't it. Sorry, hold on, wrong video.
Thank God that didn't play.
Yeah, thank God that didn't play. Yeah. All right. All right. That's great.
I really don't know what to say, really. I'm so nervous.
You know, when you see Ruby, you can tell she has like a glow about her. There's something special about Ruby. So Ruby comes in, and you can tell right away that Ruby is a good-hearted person. But at the same time, you can also tell that she lacks a lot of self-confidence.
Your first impression, your smile is everything. And when you're not smiling, it takes away. I wasn't able to smile, I wasn't able to be myself. And in a few hours, I will be.
You know, the whole concept of the Smile Again program was we wanted to find a way that we could give back to the community. And as oral surgeons, we do these radical reconstructive cases that change people's lives. And what's a better way to give back to the community than take someone from Amarillo and do a surgery on them that's going to change their life forever.
Um, I woke up, I had a brand new smile. It just felt wonderful that I could smile.
Thought she'd be a great person to give this gift to as a thank you because we know that there are thousands of rubies in our community who are single mothers who put their kids and grandchildren first and they neglect themselves.
I never felt comfortable taking pictures, so I wouldn't take pictures. Um, if I did, I didn't smile. I did a little smirk. I always held my mouth just right because I knew that if I smiled too big, I would show my teeth, and then people would see my smile.
One of the things that really touched us was Ruby would never take pictures with her family because she hated her smile.
All my kids and family would get together and we go take pictures. Sometimes I would just step back and just let them take pictures and have fun.
By giving Ruby this new smile, we hoped that she would finally feel comfortable in her own skin.
It opened up so much more in me, that I can, when I see strangers, when I'm walking in the store and stuff, I smile, and they don't even have to smile back at me and say hello to me. It just makes me feel good. I know I got a pretty smile now.
Everyone here at AOMS is so happy to see you smile again, Ruby.
I would like to thank Dr. Graves and his wonderful staff for choosing me. Thank y'all for showing me so much love. Thank y'all. Yes. I'm getting emotional. Sorry.
Yay. That was awesome.
So, I know that a lot of you guys, the question everybody wants to know is why do you want to become a dentist, right? That's what everybody asks, and I'm sure that someone's going to ask me that. You know what I mean? Probably write that down. And I would say, you guys are an undergrad, so you don't know what you don't know. And I didn't become a dentist so I could do Ruby's teeth, right? When I was an undergrad, you don't opportunities fall in your lap or come to you as you go throughout your career. And I think probably at the time, if I'm just being truthful, I was at college, I needed something. I needed some career path. I need something to do with my life. And, dentistry was, to me at the time, was something I thought, if I was comparing it to medicine, similar incomes and probably more of a better lifestyle. And maybe at the time, maybe the dental school at the time was maybe a little bit easier to get into than the medical school was. And I know that changes and, from year to year. But if I'm just being honest, it was just probably something I thought I was interested in. I knew a dentist. I worked a summer as a helper for an electrician, carrying ladders and changing electrical stuff in supermarkets. And his wife's best friend was a dentist, and my family didn't have any money. I ended up paying for my school or taking loans, and she made something like $100,000 a year, and she worked 3 days a week. And I thought to myself, man, if I made $100,000 a year, how can you spend that kind of money for one? And how do you have any problems? That would solve a lot of problems in my life if I could get a job that made that kind of money. So that was, if we're being honest, that's really was my initial reason I kind of went into dentistry. And when I went to dental school, I had no anticipation of doing oral surgery. I went to dental school to be a dentist, and I enjoyed the general dentist stuff that I did when I was in dental school. If I look at my career path, and if you compare undergrad to dental school to my residency, I would say that I probably enjoyed dental school the most. There's a lot of camaraderie with your fellow students in dental school. You're all kind of in the same boat together, so to speak. long hours and lots of lab work. And I mean, it's difficult. I tell people that's the difference between undergrad and dental school. Is undergrad, you go to your organic chemistry class, and there's probably half the class are a bunch of idiots and the other half are smart. You get to dental school and everybody's smart. So all of a sudden everybody's working hard. So I mean, if you want to be in the top, 5 or 10% of your class, I mean, it takes lots and lots of hard work compared to undergrad where you are right now. But I mean, I enjoyed dental school, and the thing about dental school that I probably enjoyed more than anything was the oral surgery clinic. I would go to the oral surgery clinic when I was out of clinic. I would spend the weekend sometimes hanging out with the residents and taking call with them, and it was just a lot of fun to me. I enjoyed doing. I was always really good at doing it, and so I got to the point where I'm like, well, I could be a dentist, and that may feel like a job to me one day, or I could go down this path where I become an oral surgeon and it doesn't really feel like a job to me. It feels fun. I enjoy going to work. I enjoy doing cases like Ruby for free because it's fun for me to do those cases. It's not a job. I enjoy doing cases like Charles because it doesn't feel like a job to me. The old image that, I'll never work a day in my life. I kind of feel like I'm kind of walking proof that you can really have that career where you don't feel like it's a job. And I mean, I've done oral surgery. I'm 12 years now. I've been out of residency, and I still enjoy every single day going to work, and I consider it fun. And I'm blessed and lucky that this is what I get to do for a living. And most days I go to work, and as I'm operating on somebody, I catch myself thinking, I can't believe somebody's actually paying me to do this. Like, I'm getting paid to do this. I mean, it would be like if you got paid to go to the gym or go to play basketball or something, you know what I mean? And I mean, that's the way I kind of feel about what I do for a living. And I would tell people, even though that I previously said I probably went into there because I thought you can make a lot of money, at the end of the day, my suggestion to anybody is, pick something that you love to do, regardless of the money, because there's more to life than making money. And having the freedom and enjoying your job, means a lot more than everything else.
For sure.
So what's the first question? Why did I become a dentist?
All right. Yeah, so we can open the floor to questions now. Let me go on and see what the questions are. All right. The first question I see is, would this procedure be possible by a dermatologist as well? So he's probably talking
Dr. Popper. Yeah. So Dr. Pimple Popper, she's a dermatologist, right? And I mean, she does similar cases to this, and I'm sure she's done these type of cases. I mean, if you look at her career, and I have mutual friends with her. I mean, she didn't start off doing these big, huge tumors. I mean, that's something that kind of evolved as she became more popular on social media. But yeah, this is definitely something dermatologists can do. I mean, if you look at this in the neck, I mean, this is something a dermatologist, a ear, nose, and throat doctor, a plastic surgeon, even general surgeons do a lot of head and neck stuff. So, I mean, this really falls into a lot of different realms.
Okay, great. And then after opening your own practice, what advice would you give to future hopeful business owners?
It's a different world now for people going in the dentistry versus when I went into the dentistry. And that's just based on, there's a lot of corporate dental out there. So it's a little bit harder to start your own practice now, just because, I mean, there's big debts now graduating from dental school, and margins have shrunk a little bit. When, 12 years ago, the margins were really pretty good, and you could be a very bad at running your business and still make a lot of money. Now that corporate dentistry is involved, I mean, you really got to know how to run your business if you want to be competitive with that type of market. I mean, there are always, regardless of how corporate dentistry goes, there will always be a niche of like the cosmetic dentist or the full mouth guy, like a Dr. Dorfman type of person. I mean, that will always exist. But I mean, you're looking at, competing competing against corporate dentistry. So it's a tough road to go down these days.
Mm-hmm. And then being an oral surgeon, how are you able to stomach those kinds of cases like the tumor or others with blood and etc.?
It's all relative, right? I remember when I was a kid getting my blood taken and passing out. Now, that was maybe like 18 when that happened. And then I passed out from them drawing my blood, right? I mean, I still don't like having my blood drawn, but I mean, it's all relative. Anytime we have an assistant or we hire a new employee that's a little bit squeamish, I mean, that goes away relatively quick. I mean, when I was in residency, it was the University of Tennessee, and there's a dental school there. And we'd always have the dental students. They would always pass out when we were doing procedures. So, I mean, you'll get used to that. You'll get over that is what I'm going to say. just like doing something like a filling. The first time you do that, I mean, it's nerve-wracking when you're working on a person, but I mean, that goes away relatively quick.
Mm-hmm. And then how much more stressful was medical residency than dental school?
It's different. It's a lot different. I mean, when you do your residency and it's long hours, and like dental school, you're kind of in it together. I mean, in residency, you're kind of like that because a lot of times you'll have a co-resident, and we took 2 per year where I did my residency. So you have a co-resident, but I mean, it's long hours. You're working a lot by yourself. I mean, you're so daggone tired all the time. You really don't have time to think, to be honest with you. So I would say that dental school was a lot more fun and residency was a lot more tiring. I mean, you're just always tired. I mean, go to the hospital, you look at the residents. I mean, they're walking like zombies. They're always tired. I mean, you don't have a break, especially your first couple of years. And I mean, I think I spent the night at the hospital 3 years in a row for Christmas. So, I mean, I spent 3 Christmases in a row at the hospital.
And then could you also walk us through how the OMFS residency was as well? Like the oral maxillofacial?
Yeah, I mean, that could be a long conversation because it is, 4 to 6 years. But, the way I did it was your first year, you do a lot of your first year, you're the intern. Everybody knows who watches Grey's Anatomy or whatever show you guys watch. The intern always just gets beat up with everything. So it's just no difference in oral surgery. So you're doing most of the grunt work your intern year. The way we did it was we had 2 months of internal medicine our first year. So we were actually internal medicine residents for a couple months. And then they all vary a little bit. We all do some type of anesthesia. We did 4 months of adult anesthesia and 2 months of pediatric anesthesia. And you're essentially an anesthesia resident. I mean, I did a lot of the OBGYN cases for whatever reason, and you're doing those cases just like the anesthesiologist would. I mean, you're functioning the same as that. And then we do an ENT and oculoplastics, but they all kind of vary, from your first to your chief year. And then your chief year, you're basically just working with the attendings, doing the larger cases. And then the other residents are kind of like your underline. They're kind of doing the grunt work for you at that point.
And then is it possible to work while doing residency?
No, you can't work while you do residency. They would probably fire you if you tried to work, to be honest with you. Every once in a while, they'll let you moonlight, depends on the program, while you're in medical school. But no, that's you just take your loans and pay it back. That's what you have to do. I mean, you get paid while you're in residency. I mean, you actually get a paycheck. I mean, you have a job.
Mm-hmm. And then do you think dental care should be more comprehensively covered in health insurance so all these people don't have to depend on charity to receive care in the first place?
I mean, yeah, you get in a political debate, but I mean, yeah, I personally believe that everybody should have the right for healthcare and dentistry. And I mean, if you look at how your teeth affect your overall health of your body and how it affects people who have heart disease and diabetes, I mean, it would be hard to argue that by providing people with minimum basic dental care who can't afford it for free, you're going to have better outcomes on the medical side. And you could really sit down and probably argue that at the end of the day, we probably save money by giving healthcare and doing more preventative stuff for people than not giving it for free. We probably end up, as a nation, we probably spend more money treating people's heart disease and diabetes than we would if we just treated their dentistry that may have led to that and contributed to that before.
Mm-hmm. And then I think you already answered this, but did you get paid during your residency training?
Yeah, you get paid, and it varies, but it's something. You know what I mean?
Mm-hmm.
I mean,
Yeah.
if you look at how many hours you work, you make like $3 an hour, right? But collectively, it was at the time it was the most money I'd made in a year up to that point.
Mm-hmm. And then I think you already answered this as well. How many years of schooling did it take?
Yeah, like oral surgery varies. I tell people, you're 4 years of undergrad, you're 4 years of dental school, and then oral surgery is 4 to 6 years. So it's anywhere between 12 to 14 years. And there's one program that's 7 years. So anyways, from 12 to 15 years after high school to be an oral surgeon.
Mm-hmm.
Which
And
seems
then,
like a lot, right? I mean, it seems like a lot, right?
Yeah.
It seems like a lot. Like 4 years, and especially you guys, you're like, man, I've been in college for 3 years, 5 more years. But I mean, I always looked at these things as just my job. When I was in dental school, my job was to go to dental school. And when I was in residency, obviously that wasn't my real job. My mom asked me one time, I think when I was going to residency, she's like, now, when do you get a job? Now, when do you finally get a job? Are you just going to go to school forever? And that's what it kind of feels like.
Yeah. And then, do you have any business tips to starting up your own practice?
I mean, make sure that's really what you want to do, for one, right? And then it takes a lot. Just because it's tough, because you go through dental school, and unless somebody pays for your dental school or you have money set aside for that, you're going to graduate dental school with a couple $100,000 in debt, more than likely. And then you're looking at starting a practice on your own, and that practice is going to cost you $500,000, if you're real cheap. It depends on how big you want to build the practice. So then you have to get a loan for $500,000 when you have $300,000, right? And then you've been in dental school, so you want to have somewhere to live and a car. I mean, there's other things that you go to dental school so you can have these things, and all of a sudden you want these things when you finish. So it's tough. I mean, it's definitely doable, but you just have to remember you're not gonna be driving your Range Rover your first year or two to do something like that.
Yeah. And then
my advice was, you just have to be patient. You know what I mean?
Yeah.
With us, we're successful, and I mean, I take lots of business risk. I mean, we have TikToks, we do live surgeries on Snapchat. So I mean, I've taken a lot of marketing risk, and at the time nobody was doing it, and obviously a lot more people are doing social media now. But at the time when I first started doing it, nobody really was doing it. And I think that the thing when it comes to business and marketing, especially something competitive like dentistry, I was like, man, you really got to think outside the box, and you got to be creative, and you got to be willing to take chances. I mean, that's there's nobody in this world who's super successful that didn't take huge chances in life and risk everything. There's, Jeff Bezos, all these people took big chances and they risked everything, and it just paid off. And you have to be willing to try those things.
For sure. And then we have someone that said, I'm currently a junior in high school. What would you recommend I do in high school to prepare myself for undergrad years?
Just focus on your TikTok account, 100%. You're worried about school, just focus on TikTok. I tell people, here's the deal, is that at the end of the day, it'd be nice if we all went to Harvard, right? But at the end of the day, it doesn't really matter where you go to dental school. Your grades matter, and your DAT score matters, right? So, I mean, if you don't get into Harvard, it's not the end of the day. And I tell people, really, the life really starts when you get to college, right? Because it's hard to make up for your freshman year. If you screw around your freshman year and you make bad grades, you're constantly digging yourself out of that hole, and you're trying to get your GPA up. So, I mean, if I was in high school and I was going to say, you want to go to dental school, then you need to show up day one focused. That's what you want to do, because it's so competitive these days to get into professional school that it's really hard to make up for those mistakes. So a lot of people make their first year, and then all of a sudden they're sophomores, and they said, I want to be a dentist. And then they have this humongous competitive field where all these people make good grades their first year, and they're trying to make up for that. And it's really hard to dig yourself out of that kind of a hole. And I think at the end of the day, a lot of people screw themselves because they get to college and they don't focus and they have too much fun and they don't make the grades they need to make, and they just, I mean, they're just destined to fail.
Mm-hmm. And then, well, someone asked something similar. Is there anything that you can recommend for high school students interested in dentistry? It's TikTok. And then, what are the best steps to start a dental practice or a clinic? Should you take business classes in undergrad to prepare for the business side of dentistry?
Yeah, people, I mean, that's it, because you do get like practice management classes in dental school, but they're awful. You don't learn. Personally, you know, most of the people who are teaching those are people in academics who aren't in private practice or have never had a private practice. So I don't think they're giving you a lot of real life advice. I mean, they give you a lot of like, this is how you do your accounting, and this is how you manage your books, and all that stuff's important. It's tough because I like to say, I think that if you went to undergrad and you took a lot of business classes and you just focused on your prerequisites for a dental school, but you did like a, you know, like a financing degree or something like that, that would help you. But at the same time, I would say, you know, you're going to go to dental school for 4 years, so you may forget a lot of that stuff you learned in undergrad either way.
Mm-hmm.
I would say that, yeah, that stuff may help, but it's not a must. You don't have to have that stuff. You know, you just have to be willing to learn that stuff as you're in private practice. And, you know, life, it's like you do learn a lot of life lessons just by trying things and failing. I mean, that's at the end of the day, I mean, college prepares you for the business world, but does it really, you know what I mean?
Yeah, that makes sense. And then what's the best advice you can give to someone to be successful in dental school?
Yeah, I did a lot. I went to dental school at the University of Louisville, and that's where I was from. So, I mean, I had a lot of people who I grew up with that I was able to work on in clinic. So when it came to clinic, I was successful just because I had a lot of the patients. I had plenty of patients to choose from. But at the end of the day, you're just going to have to treat it like a job, and you're just going to have to work hard, and you just have to just accept the fact that you may not have much of a life for at least the first 2 years of dental school. I mean, once you hit clinic, life gets a little bit better, but those first 2 years are really, really tough. Your schedule is going to be a lot harder than anything that you're used to in undergrad. And you just have to accept the fact that my life is dedicated to studying, and that's the way of being successful.
Mm-hmm. Have you inspired any other dentists to do pro bono cases?
I don't know. Maybe they do. Maybe they don't. You know what I mean?
Yeah. It's up to them.
Yeah, I'd like to think that we do. You know what I mean? I'd like to think that people look at our programs and say, "Oh man, they get a lot of satisfaction out of doing these programs," and maybe I would do the same. And the difference between a lot of like a pathology case, it doesn't cost much for me to do that case because I mean they're essentially paying for my surgical skills. But when it comes to dentistry, I mean they do have Crown and Bridge, they do have fees, so I mean it may be a little bit more difficult for a dentist, definitely more expensive for a dentist to do a pro bono case probably than it would be for me, but I would like to think that we've inspired people to do that. Really, I mean, at the end of the day, I mean, why wouldn't you want to do something like that? Who doesn't want to somebody when it comes to something like that, especially if you have the ability to do that.
And then how long did it take you to pay off student debt from schooling?
Still paying. But you know, here's the difference is like when my student debt, I think my interest rate's like 1.3%. So I don't know what the interest rates are these days, but at 1.3%, it doesn't make sense for me to pay that off any faster than I have to. I mean, it's essentially free. I mean, I paid my house off before I paid my loan off. So I'm still paying on it. It doesn't go away.
Yeah. And then how has social media helped your practice?
No, social media is a big part of practice. We have Chris right here. Yeah.
Then I'm a big part of something. That's great.
But no, we probably get a patient every day from social media. So if you look at a return of investment on us, it's relatively good. And you know what? It brings a lot of the culture of our practice. I mean, we have I really stress having culture with the staff. So the social media really creates a big bond with our staff, and we have a really good support staff. I mean, we have 160 employees that work in our
Wow.
business, and a lot of those employees on our social media are kind of little like local celebrities. So it really helps the morale of everybody in the office.
Yeah, it's awesome. And then is it difficult to get referrals? Do you really have to go door to door to meet dentists?
I mean, I mean, that's the traditional model, right? Is that if you're an oral surgeon, you get your referrals from the dentist. The problem is that you have corporate dentistry coming in, and the corporate dentistry their own specialists that they bring in. So that traditional model of me romancing the dentist to get the referrals, I mean, that's really going away. And that's part of the reason you see us doing lots of social media, and we do a lot of direct to consumer marketing. So, I mean, our goal isn't necessarily get the patient from the dentist, even though we do, and I appreciate those referrals, but our real goal is, okay, let's educate the public and let's let the public decide where they want to have their oral surgery, not the dentist telling where they need to go.
Mm-hmm. And then what was the average age for dentists during residency?
Average age for like the resident. I mean, you think about
Yeah, I
it,
guess.
I mean, it's probably, I mean, if you go to college and you're 18, you graduate undergrad when you're 22, you go to dental school, you graduate when you're 26. So, I mean, somewhere between, I don't know, 26 and 34 would be like the range.
Got it. And then what would you say the major difference between practicing at a hospital versus a private practice is?
The type of cases that you're probably going to do, you know, and if you're
Mhm.
practicing in a hospital, you're probably doing a lot of trauma cases. You're doing a lot of like assaults and car accidents and mandible fractures and those type of cases. Working a lot of sick people at the hospital. I mean, even in our practice, you know, really, really sick people we take to the hospital to do those cases. But that's going to be just going to be more your type of cases. I mean, most people aren't going to go to the hospital to have their wisdom teeth taken out.
Mm-hmm.
Right.
Yeah. Yeah. And then do you recommend a GPR or AEGD residency for those who want to be a general dentist in states where residency isn't required?
You know, the thing about those programs, those are good programs, you know, especially the GPR program, because a lot of those are hospital based. So people who are interested in doing like bigger complex cases that are done at a hospital where the patient's intubated and asleep in the operating room, I mean, you get a lot of experience doing those cases, doing a GPR. But at the same time, depends on your school, and it really depends on the person. I don't think it's a must, but if you want to do a residency and you apply and you didn't get into a residency, you know, I think doing a GPR is a better way of spending that year while you reapply than going to a private practice.
Mm-hmm.
And private practice is that once you go to private practice, you start making decent money. It's hard to go back. GPR, you're like a resident. You're not making good money, so you're still poor. So you haven't seen like the light at the end of the tunnel. You haven't tasted like the good life yet. So postponing the good life as much as possible is probably always a positive.
Mm-hmm. How competitive was it to get into the oral surgery residency?
Yeah, it's everything. It's crazy competitive, right?
Mm-hmm.
Crazy. Oral surgery, dental school, all this stuff's crazy competitive.
Mm-hmm.
No, it's ridiculous. You know what I mean?
Yeah. Does your academic pedigree matter for oral surgery?
When you mean your academic, you mean like your family you come from, like your dad was an oral surgeon,
sure.
was an oral surgeon. I mean, look, all
sure.
that stuff. We live in a society that who you know still makes a difference to a certain extent. So I would say it probably shouldn't make a difference, but it probably does to a certain degree. But I mean, nobody in my family. I had one person. My dad's the only person who ever graduated college in my family. So I mean, I would say that I wouldn't put too much weight on that.
Mm-hmm. Or like they could be like academic past, like if you did a bachelor's and a master's, then like that.
No,
if you did multiple stuff.
look, yeah, I think so. I mean, obviously, if you have your PhD in analytical chemistry, obviously you're going to have a pretty good shot. You're going to have an advantage over some people. And like my dental school, we had people who went to pharmacy school. We had a guy who had his master's in anatomy. I mean, obviously those things help you, definitely makes you a lot more competitive when you're those things.
How did you personally manage to put yourself through school? It seems quite hard.
Yeah, I mean, I just took out loans. I mean, I took out, well, my family didn't have any money, so I got some grant money. I got some scholarships, and I just took out loans for everything. And I mean, part of my motivation to do well in school was at some point I was going to have to pay this loan back. Either I could be a dentist paying the loan back, or I could be back changing light bulbs at a grocery store trying to figure out big things. You know, and that was part of my motivation to work hard to finish.
For sure. I think you already answered this. What your tips on undergraduate students who want to go to dental school?
Yeah, I get that a lot. I mean, obviously you have to have good grades and you have to have a good DAT score. And that's probably the most important thing that you can do. I mean, I did research when I was an undergrad at the dental school, and I'm sure that helped. If anything, that gives you a topic of conversation when you have your interview. Your grades are going to get you the interview. The other stuff gives you something to talk about during your interview. Because everybody who's interviewing probably has the grades to get accepted to that dental school. And it's just a matter of the person interviewing likes you or they don't like you. And those things give you something to talk about. And people at dental school are in academics. They like things like research because research goes on at dental school. So it gives you something to talk about that they enjoy talking about.
Can international dentists become an oral surgeon after DDS in USA, or one needs to be a green card holder or a US citizen?
I don't know the answer to that question. I mean, you can be an international student that's a dentist in another country, and you can come to the United States and become a dentist. I think it varies with different states. A lot of times you have to do your last 2 years of dental school in a U.S. dental school to get your degree, and you become a dentist in the U.S. And if you have a degree in the U.S., you can always do a residency in oral surgery. You don't have to be a U.S. citizen to do an oral surgery residency.
And then what is the name of your business? Someone asked.
Yeah. So we're Amarillo Oral and Maxillofacial Surgery, but we also have our dental practice, which is called Full Smile Dental.
Cool. And then what kind of research do dental schools conduct?
I mean, they do all kinds of stuff. I mean, when I was in undergrad, we did research on cleft lip and cleft palates. But I mean, they're going to do, who knows what they're doing now. I mean, things are a lot different now with DNA sequencing than when I was in dental school. But I mean, yeah, they're all doing research because they all get funding from the government to do that research.
Someone said bonus points for getting Dr. Graves to say Chris deserves a raise.
See, I'm telling you, we did. How many interviews have we done?
It's not going to happen.
Brought up every single time. Every single time he brought up.
Not gonna.
I'm telling
you.
Dr. Graves, it looks like we're running out of time, but thank you so much for coming. I wish you the best of luck with your social media, TikTok, of course.
And I'll put a little screen up here of our social media stuff, and you can continue talking on me, see if I can. Here.
Everyone, I'm going to link the quiz in the live stream right now. Give me a second.
Yeah, it should be in the live stream chat, the group me chat as well, and then the link tree found on our Instagram bio as well.
Bye. Do we even use that, Chris?
Man, we thought it was going to blow up. Yeah.
Yeah. Well, that's why you don't have your grades, right?
Yeah, that's what it is. I bet on Byte, and it's not good. I might as well get rid of that. I'm not edit this.
Okay, guys, I just sent the quiz in the chat. Please let me know if there's any issues.
All right. Well, thanks, guys.
And I think that's everything.
Yes, I think that's everything. The quiz, it'll remain open for 12 hours for those who weren't able to watch the session live. And thank you so much again, Dr. Graves. I hope everyone has a great night and see you at our next session on Monday.
Perfect.